Hello, my name is Abby Carter. I am a nurse practitioner student at Eastern Kentucky University. Today I will be discussing smoking cessation in the pregnant population with a focus on counseling as an intervention. The healthcare problem that has been chosen is smoking cessation within the pregnant population and up to 6 months postpartum. Now we will discuss why the problem is important. First off, we are dealing with a vulnerable population that not only affects the pregnant mother's health but also the fetus. This is two lives within one body that must make a positive decision that benefits the health of both. As many of us know, smoking can cause health issues such as increased risk for miscarriage, poor oxygenation for the fetus, and premature births. Although we understand this, many still lack this information and education. It is reported by the Centers for Disease Control and Prevention that 1 in 10 women report smoking in the last 3 months of pregnancy. It was also found that 11.3% of females 18 to 49 who had a live birth in the past 5 years stopped smoking during the first trimester and stayed off cigarettes. The Healthy People 2020 goal is to increase this number to 30% for the nation. Only 11.3% stopped smoking and remained smoke-free throughout pregnancy. This is an alarming number and requires intervention from us as healthcare providers. I feel it is our duty to educate and provide health promotion to people across the lifespan as nurse practitioners. I performed a literature review finding 2 studies that met my inclusion criteria. The inclusion criteria included full text available, published within the past 5 years, using the pregnant population, a level 2 or level 3 study, using counseling as the main intervention, showing a positive result for smoking cessation. The 2 studies used are Lee et al., which is a 2015 study, and Jimenez-Monroe, which is a 2013 study. Lee conducted a randomized control trial to determine the effects of a theory-guided cognitive behavioral counseling intervention for smoking cessation during pregnancy and postpartum. Patients were randomly assigned using a computer generalized program to the control group and the intervention group, which was where they would receive the cognitive behavioral counseling. Both groups received 2 prenatal and 2 postpartum sessions. The cognitive behavioral counseling group involved high-intensity therapy with multiple sessions throughout pregnancy. These sessions occurred in person during the 2nd trimester, the 3rd trimester, and the first postpartum visit. There was then a telephone boost session performed. There were 277 patients in this study. They were recruited from a prenatal care clinic at Temple University Hospital in Philadelphia. The average number of cigarettes, intention to quit, and smoking cessation rates were all measured through self-report. Study findings revealed that smoking cessation rates were not significant between the cognitive behavioral counseling group and the control group at 3 follow-up appointments, but were significantly different at the 5-month postpartum. It displayed that at 5 months postpartum, participants in the cognitive behavioral counseling group were significantly more likely to be abstinent compared to the control group. Study number 2, which was the Jimenez-Monroe study, conducted in 2013, also conducted a randomized control trial. They analyzed the efficacy of a proactive intervention during the postpartum period to prevent a relapse in recent quitters and to promote progress in the behavioral process of change in smokers. Patients were randomly assigned to intervention groups which consisted of a motivational interview and relapse prevention. This is compared with the control group, which was receiving standard care. The intervention group received 4 telephone support sessions in week 3, 6, 9, and 12 postpartum. The control group had 2 telephone sessions at week 3 and 12. Women who were used for the study had given birth at the University Clinical Hospital of Lozano Blesa of Zaragoza. There were 412 participants in this study. The study revealed that the probability of remaining abstinent after 12 weeks was 74% for the intervention group compared to 37% for the control group. It was also found that 90.7% of the intervention group said that they would be ready to quit in the following 6 months versus the 18.3% for the control group. The study findings from both of these studies can be applied to nursing practice to help improve the health of a large population and also a vulnerable population. The research displayed that counseling these women through this tough time will aid in assisting these women to stay abstinent from smoking during and after pregnancy. By increasing the number of interactions with the pregnant postpartum patient, it increases their likelihood to remain smoke-free. Knowing this information can guide nursing practice to benefit this population. Based on these results, counseling programs should be implemented within pregnancy and postpartum clinics. These programs will need to include multiple meetings either by telephone or in person throughout pregnancy and continue through postpartum. There will need to be 3 or more counseling sessions performed and be maintained through at least 5 months postpartum to obtain the maximum results. The intervention can take place in multiple environments that would affect advanced practice nurses, including pregnancy clinics, hospital settings, and family practice areas. Thank you.